Hi, my name is Samantha. This presentation is going to investigate the role of physical activity in aging. It will explore how the form of leisure activities and planned exercise can slow the damage associated with aging. Physical activity is vital in improving health, both physically and mentally, and improving independence and quality of life. There are many definitions of aging, but it is important to note that aging is not consistent with chronological age, nor is it a disease. Aging can be quite complex, and there are many theories behind what causes aging on a cellular and molecular level. The focus has changed from anti-aging into healthy aging, and many international bodies are recognizing that. The World Health Organization has designed international campaigns around the definition of healthy aging, which is the process of developing and maintaining functional ability that enables well-being in older age. So we're going to look into how physical activity can assist into this healthy. One of the longest studies on aging and physical activity was done by Gulseville and colleagues. These colleagues started with 6,738 Norwegian subjects. They surveyed these subjects between 1965 and 71. 42 years later, they followed up these subjects. Quite a few of them had immigrated and some participants had passed, so they looked into the mortality rates of those past participants and how they correlated with physical activity. They still had 5,625 records from physical activity. So from those records, physical activity was correlated with stroke rate and heart disease in those participants that had passed. And that mortality rates were linked to low or no physical activity across all age groups. So not just in the elderly, but that low physical activity was correlated with the elderly groups as well. In the oldest group, low physical activity was the second highest predictor of mortality after hypertension. Interestingly, though, exercise can be used as a treatment for hypertension or preventing hypertension. In a study from Nuremberg and colleagues in 2011, they found that circulation can be improved by exercise as it increases the nitric oxide availability. Nitric oxide is important vasodilator, and they found that in sedentary individuals that they had lower levels of nitric oxide, but exercise intervention helped them oppose this reduction in nitric oxide. So therefore, exercise can increase the nitric oxide availability, therefore decreasing the hypertension rates with exercise as well. The greatest finding from this 42-year study demonstrated that there was a long-lasting inverse association between physical activity and mortality from all causes. This was consistent with other studies from different socioeconomic levels. Vankoff in 2017 studied close to 34,000 participants from low and middle income countries, and they found that there was a high correlation between lack of physical activity and most other chronic conditions. They also included asthma and arthritis into their in this study that there was a correlation between sedentary behavior and hearing loss and visual impairment, which is also an interesting find. So in terms of brain and cognition, so other things that can be affected by exercise, aging can cause changes in the brain, and cognitive conditions such as Alzheimer's and dementia are seen in elderly. The hippocampus region of the brain, which is responsible for spatial memory, can decrease in volume by 1 to 2% a year in people with dementia. Exercise interventions in this population can increase the volume of the anterior hippocampus by 2%, so therefore decreasing or reversing that volume loss. They have also found that there is greater aerobic fitness levels have an association with greater performance in these spatial memory tasks. The increase in performance in spatial memory tasks can be explained by the increase in brain-derived neurotropic factor, so BDNF, which is crucial for maintaining brain neuroplasticity and cognitive functioning and memory formation. It's generally accepted that exercise increases BDNF, and there is evidence to show that increases after 35 minutes of acute exercise can be achieved in BDNF. One study found, so in terms of other brain functioning, one study found that the prefrontal cortex cognition can be improved from bouts of 50 minutes of high intensity exercises. And these improvements in cognitive functioning can last between 30 minutes to 2 hours. So if these cognitive and brain functions aren't enough to still influence you into increasing your exercise, there is also a study in 2011 that shows that physical activity can also make you a better driver. They found that it greatly improved their speed of behavior during road driving tests after exercise intervention. As well as having benefits physically and mentally, studies on the elderly have also shown that those that participated in physical activity had reported higher scores in health-related quality of life. So the research shows that physical activity can have a very important role in successful aging. Besides decreasing morbidity and mortality rates, it can also improve cognition and brain functioning. But physical activity can have more benefits than that also. So I just wanted to end with a short case study. Most people relate aging to becoming weak and frail, but this is not inevitable. Exercise can really help you to improve your physical and mental strength as well as resilience. In this video, this is John. John is my dad. My dad started CrossFit about 6 months after he had major abdominal surgery to remove part of his bowel that was affected by cancer. CrossFit and exercise and physical activity has helped my dad to stop smoking and stop drinking alcohol. He has a very healthy cardiovascular system now. This is him competing in his second CrossFit Open, and he came 18th in Australia in the over 60s division. So for him, and I'm sure for many other people, physical activity has quite a lot of positive effects on people's lives. Physical activity played a huge part for him as he's aging healthy, and I would say he's stronger and fitter than most 20-year-olds I know. So going back to the chronological age, aging is not just about that chronological age, it's about being healthy. Very much.